Okay, good day everyone. Good morning from Nigeria here, and good morning, good afternoon, or good whatever is your time at your own end. You're welcome to ATP on Fresh Waves Radio again, and it's a pleasure to have Dr. Gbemisola again today. At least this is becoming consistent, and it has been amazing. Thank you very much, ma. And we are doing this in the honor of the World Breastfeeding week, yeah, that we have around the world. So today we are talking about breastfeeding or anything that has to do with breastfeeding. So we are happy to have you again, Dr. Gbemisola. Thank you very much for doing this. You're welcome, ma.
Yeah, good morning. Good morning, everyone. Good morning to those watching us on
Watching us on
Facebook and those of
Facebook
us
and
watching
those of us
us
watching us.
on the Instagram. I can see you. Welcome to ATP Special Hour on Fresh Waves Radio. And for those who are listening to us, Fresh Waves Radio, you are also specially welcome. And those who are watching on YouTube, you're especially welcome. This is a special ATP live, as because, like Esther said, it is the World Breastfeeding Week, the 1st of August to the 7th of August every year has been demarcated or dedicated to breastfeeding, promotion, and education. And so that's what we've been doing for, especially for those of us on Ask the Pediatricians. We've been doing a lot on breastfeeding this week. And so it's a pleasure to also be here on Fresh Waves Radio and also on all our Facebook groups and YouTube channel to talk about breastfeeding. So today we're just going to talk about breastfeeding. If you have any question on breastfeeding, please ask. And then before that, I'll hopefully do a little bit of overview of what is breastfeeding and all that. And then you can ask your questions about breastfeeding, any challenges with breastfeeding or any issues whatsoever on breastfeeding. Let's try and just keep today about breastfeeding. But before we start, can you please just share the video? Make sure you share it, send it to all your friends, anybody that you know should be listening at this time. I'm also trying to do that. And so just give me a few minutes just to check that everybody on our groups can see me and can hear me. Please share the video, and we're just going to be doing this for the next 1 hour. I'm just checking that the videos are pinned to the various groups and everybody can see it. Okay, I think I can say that. So welcome, 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 everyone. Just give us 2 more minutes just to make sure we have all the videos pinned and very visible in all the various groups. Then we can roll on quickly. You're welcome, everyone. Okay. Again, it is the World Breastfeeding Week, and we on Ask the Pediatricians, we are very passionate about breastfeeding, and I will tell you why in a few minutes. Um, just checking that everybody can see me and can hear me. Okay. Okay, I think that's all sorted. Okay, good. So yes, so I can now focus on the breastfeeding itself. Okay, so welcome everyone again to the ATP Live Special on World Breastfeeding Week. This today I'm just going to talk a little bit about breastfeeding and why is breastfeeding important. Why do we have to dedicate one entire week to breastfeeding? Okay, and why do we have to celebrate breastfeeding? That's what I think all of you know what I meant by breastfeeding. Is the process of feeding a baby using the mother's breast, using the milk coming from the mother's breast. Now, just a little bit of overview before I start to take your question. Breastfeeding is a very, very important thing for us. Um, excuse me. It is one of the most effective ways to ensure that a child survive. Is when we talk about child survival, for those of you who have been listening to us for a while, we always talk about things that will help our children to live and not die. Because as we speak, about 5 million children die every year globally, and most of these days are due to things that are preventable, that are treatable. And if you know, our vision on Ask the Pediatricians Foundation is how to see how we can reduce that death. And most of them are concentrated in Nigeria, India, sub-Saharan Africa, basically. So we are the ones that deal a lot with some of these childhood deaths. And we look for how can we reduce the deaths of our children. And so all those things that we can do that can reduce the deaths of children, we call them child survival strategies. And breastfeeding is one of them. Okay. So it is one of the ways by which we can ensure our children live and all that. And that is why you will know that pediatricians, Ask the Pediatricians Foundation, we talk a lot about breastfeeding. We celebrate exclusively breastfed babies and all that, because we want mothers to breastfeed their babies, and it's something that doesn't cost anything. It's cheap, it's free, it's available. But it will amaze you to know that the exclusive breastfeeding rate in Nigeria is 17%, 17%, 1 7. That is very, very low. And close to 1 million children every year would have been saved, would not have died, before the age of 5 years, only if we're able to practice exclusive breastfeeding. So giving you that background, you can now understand why it is important for us to talk about breastfeeding, because it's an effective way of of reducing child deaths. So in other words, if we scale up breastfeeding to universal levels, in other words, if we are getting into like 100% of all babies born in this world are exclusively breastfed, we are going to be saving 820,000 children every year. In other words, 820,000 children we should have died, will not have died, only if we're able to get exclusive breastfeeding rates from the level we are right now to like 80 to 100%. If we get it to 100%, you can imagine 1 million, almost 1 million children lives saved every year. So that is something really, really important. It's a food for thought. And that tells us that if we can do that, I mean, we are talking about how to reduce, and breastfeeding is something that's not going to even cost us anything. And yet it will reduce almost 1 million out of the 5 million deaths we are talking about. So it's definitely something we need to know. It's definitely something we need to talk about. Globally, only 40% of children are exclusively breastfed. I said Nigeria is even less than the global level. Nigerian level is 1/7, while globally is 40% are exclusive breastfed for various reasons, which I'm sure you all know. But I just want you to see what we are losing. We are losing almost 1 million children every year that we could have saved if only we have been able to practice exclusive breastfeeding at 100% level. And so that is why WHO, Ask the Pediatricians, UNICEF, all of us that are interested in child health and child survival, we cannot but talk about breastfeeding, and we will keep on talking about it. We keep on drumming it. I know a lot of mothers sometimes have taken exceptions to Dr. Gbemi always talking about breastfeeding and always promoting breastfeeding. And because most of the mothers are only looking at it from their own individual level, and they're looking at it from their own personal level. But I am looking at it from the global level, and I'm looking at it about, if we can get all of you exclusive breastfeeding, 1 million children who would have died will not die before the age of 5 years. So it is something very important. And that is why we will keep on talking about it, because as you're aware, we are committed to reducing all these child deaths. Preventable child deaths, we are committed to reducing them to zero. And that is why we promote exclusive breastfeeding as the best way to feed your baby in the first 6 months of life. That is the only food a baby should take in the first 6 months of life. And it is very crucial. It is very crucial that babies take only breast milk in the first 6 months of life. No water, no agbo, no drugs, no formula, no other milk, no other animal milk, no water, only breast milk. Okay, that is what we mean by exclusive breastfeeding. I always like to stress that, because when we say the breastfeeding rates or exclusive breastfeeding rates, we're talking about exclusive breastfeeding. We're actually a culture that breastfeed our children. We're a culture that do a lot of breastfeeding. Our exclusive breastfeeding rates would have been higher if not that people also give water. So we breastfeed, but we also give water. That is why our level is at 17%, because there are a lot of myths and misconception about babies also needing to take water when they are being breastfed. And that is why our rate is lower. I'm sure that if all the mothers that are breastfeeding in the first 6 months of life do not give water and do not give formula, our breastfeeding rates in Nigeria will be very, very high, because majority of mothers in Nigeria, we actually breastfeed our children. But the reason why our level is low is because we give water or we give other things. So what we're saying is that if you're breastfeeding for the first 6 months of life, no water, no agbo, no other formula, your breast is enough. So it is very crucial. And when we talk about breastfeeding, breastfeeding is more than just feeding your baby. It is more than just putting something in the tummy of the baby. We're talking about protecting the baby. Every other thing else you give, they will only give food or something to the baby. But there are other things that only breast milk can do. All right. So that is why it is more than food. It is more than just filling the tummy of the baby. It is about making sure that this baby has the right nourishment for their growth and also for their brain development. It's also about protecting them from infections, okay? Because there are a lot of antibodies or things that will protect your baby from infection cells, immune agents in breast milk that you as a mother, you pass on to your baby, that your baby is not going to get from anywhere. And that is why babies on exclusive breastfeeding are less likely to have infections or illness, whereas babies on formula are likely going to come down with that. And so breastfeeding is more than just feeding. It's also about protecting a baby. We're also talking about protection from allergies. Okay, most of these other things we give to the babies can react to them, but breast milk, it keeps them safe from those allergic conditions. And the effect of breastfeeding goes beyond that first 6 months or 2 years of breastfeeding. It goes all down the life of that child. Even as adults, a baby that is exclusive breastfed is protected from things like diabetes and other conditions like that, so that, and obesity. So that is why it's best to exclusive breastfeed. Also, babies that are exclusive breastfed, research have shown that they have a higher IQ compared to babies that are not exclusive breastfed. So these are all benefits of breastfeeding, and that is why we recommend. That's why the World Health Organization, UNICEF, Paediatricians, we recommend that all babies should be exclusive breastfed in the first 6 months of life, and that breastfeeding should be initiated within the first hour of life. Now, this is very crucial because a lot of mothers, when we have our babies, a lot of our processes like, cleaning up the mother, cleaning up the baby, we sometimes forget about breastfeeding, and it is really, really unfortunate. And that's why UNICEF started what we call the baby-friendly hospital initiatives. And the idea is that those hospitals adopt processes that make sure that they promote and encourage breastfeeding. And one of the things is that when the baby is born, you don't really need to give the baby a bath. You just clean the baby and put the baby on the mother's chest, abdomen, and that baby will find his or her way to the breast, latch onto the breast, and start sucking immediately. It doesn't even need any help from you. It is so intuitive onto the baby that the first thing I need to do is to find my mother's breast and latch onto it and start sucking. So we want babies to start sucking within the first hour of life. We don't want babies separated from their mothers. We don't want babies being kept in one room and what they call nursery and the mother. No, babies must be with their mother all the time. That will encourage the mother to breastfeed, because the smell of the baby, the crying of the baby, everything the baby does stimulate the mother's breast milk production. Okay, we don't want hospital staff giving babies water or glucose water or formula because they say, oh, the mother is resting, oh, she's not yet lactating. I can always say, the baby sucking on the breast is what is going to make the milk to flow. So when you don't give the baby the breast, the milk will not flow. So we don't wait for the milk to flow first before the baby starts sucking. The baby needs to suck on the breast, and it's just sucking that will allow the milk to flow. So we want you to practice exclusive breastfeeding, initiate that breastfeeding within the first 1 hour of life. And for the first 6 months, only that breast milk is enough for your baby to grow well, for your baby to have good development of the brain and everything, for the baby to be healthy free from infections, free from all sorts of allergic conditions and all that, only breast milk is enough for the first 6 months. And after 6 months, of course, we want you to keep on breastfeeding beyond 6 months for the first 3 years of life. So breastfeeding after 6 months will not be enough for the baby. So that is when you add other things. But if you are adding other things, you are not stopping breastfeeding, you are not replacing breastfeeding, you are only adding. It is a complement. That's why we call it complementary feeding. So you should still keep breastfeeding your baby as much as you were doing before in the first 6 months of life. After 6 months, you keep breastfeeding the same way, but you now start adding the other food, what we call the complementary feeding. And I think I've talked about infant feeding before. You can always watch that previous episode. But first 6 months, breastfeeding. Beyond 6 months, breastfeeding plus other food. So I've already mentioned why it's so important for you to breastfeed. It protects your children from infections, childhood illnesses, and all that. Breast milk is an ideal food. It's complete. Everything is there, including the water, because which is the problem. A lot of the grandmothers, especially, they were like, how can somebody eat and not drink water? And I always tell them breast milk is 70% of it is water. All right. So God has put everything together, including the food, including the water. So you don't need to go look for water. And this is so good for us, especially for those of us in Africa and in other parts of the world where we don't even have access to good, clean water for drinking. Because a lot of mothers actually cause problem for us by giving those babies water, because then they give them unclean water, which is contaminated, and the children start having diarrhea. And diarrhea is one of the childhood killer diseases. Most of children die from diarrhea. This diarrhea is preventable if only the baby was not given water, because the water that comes from the breast milk is already clean, purified. It is free from germs, which is what you cannot guarantee with other water. Apart from that, even if you get clean water, that water is diluting the breast milk further, and that means that water is 0 calories. So that means the space that the baby should have used to store milk, you've already put water inside, and that means the amount of milk baby will be able to take in will be less, and that means less calories to the baby. And that is why some babies don't gain weight and they will fail to thrive, because we are giving them too much of liquid in their tummy, which is not really big in the first instance, and then there's no space for the real food, which is the breast milk, that will actually make them to gain weight. So we don't want you to give them water. We want you to give them only breast milk, because breast milk already has all the water that the baby needs. All right. So all that the baby needs, the food, the water, everything is in breast milk. It's a complete balanced diet. Everything is in it, and that's all you need to give for the first 6 months of life. And like I said, it is safe, it is available at the right temperature at any point in time. You don't need to be looking for bag or buying bottles or boiling water, wasting electricity, wasting gas, and sterilizing and doing all that. You and the baby, that's all you need. And you can just go and it goes with you everywhere. So we want the baby to be on breast milk. But like I said, apart from the fact that breast milk gives baby food, water, and everything baby needs, it also contains a lot of antibodies. Things that protect your baby from those illnesses, pneumonia, diarrhea. These are the things that kill our children. I've talked about that before in previous episodes. What are the things killing our children? Those are the things causing the first 5 million deaths. Pneumonia, diarrhea, and all that. And that is why when you exclusive breastfeed your baby, you are not just feeding them so that they can gain weight and be big, but you're also protecting them. And I think if mothers understand that, then they get it, that your breastfeeding protects your baby from these diseases, then you really want to do it, and it will reduce those mortality. And also, breast milk is not only just for the baby, it's also for the mother as well. There are also some benefits for you as a mother when you exclusively breastfeed your baby. For example, it helps your womb to get back to its shape faster. It contracts the womb, and then two, you may not even see your period, and that's a form of family planning, a form of protection against getting pregnant so soon. Of course, it's not 100%, so we still always recommend that you use additional form of contraceptives, but it's a very good way of protecting your baby against for protecting yourself against another pregnancy so soon. So and also protects you against breast cancer and ovarian cancer. So the longer you breastfeed, the more you are protected as a mother against ovarian cancer and against breast cancer, even against depression, against diabetes. So you can imagine that even though you are breastfeeding, which has a lot of good benefits for the baby, but you also are benefiting from it as well as a mom. Can imagine it reduces your risk of breast cancer, your risk of ovarian cancer, that type 2 diabetes, depression. So I mean, why wouldn't we breastfeed when we have all these wonderful benefits? And of course, like I said, the effect of breastfeeding extend beyond that 6 months or 2 years that you breastfeed. It goes into the life of that baby for even as adults. So they are less likely to be obese, they're less likely to have diabetes and all the babies that are breastfed. So I've mentioned that. And when we did intelligence tests, we found out that babies that are exclusive breastfed did better in the intelligence test. So the long term of effects of breastfeeding can never be replicated by formula. Okay, so formula cannot give you all those benefits. Most formula is just food, gain weight, and that's it. And they also create other problems, because you have to use bottle and all that, diarrhea. Some of them babies are allergic to them. You have cow milk protein allergies and all those other conditions. So that is why we WHO and all of us will recommend exclusive breastfeeding. And some people, when they're using formula, because when you really really want to do formula, you're going to be buying maybe two things every week, because it's not going, one thing will last maybe 3 days, and most of you know that. And so because also, and they are so expensive, and so mothers always want to let this last longer for 1 week, and then it over dilutes it, and the baby can hustle now not gain weight. So whereas breast milk is free, is cheap, and you don't have to do anything, and you just do it always on the go. So that is why we recommend exclusive breastfeeding. All right. So uh and if you don't start your breastfeeding and you go on formula feeding, and if, for example, you are now struggling with formula purchase and all that, then because breastfeeding is a demand and supply, the more your baby suck, the more you lactate, the more you breastfeed. If your baby stops sucking, the body shuts down breast milk production. There's no waste in nature. So that is why mothers who don't exclusively breastfeed and rely on formula, then their milk tends to dry up. And then you say, I'm not lactating. No, you can lactate is because you stop breastfeeding, and that is why you're likely going to uh, stop producing milk. Now, so a lot of people say, okay, what about mothers that have HIV? In the days when HIV was first discovered, when we are still struggling to understand HIV, we actually thought that, because HIV can be transmitted through breast milk. So mother to child transmission of HIV is possible through breast milk. So because of that, we think, okay, let's just be giving those babies formula and not give them breast milk so that they will not have HIV. You know what? The babies were dying more from the formula than the HIV. So they don't have HIV, but they were still dying. So we found out that it's actually not helpful, even for the babies that have HIV, to give them formula. So right now, what we do is to actually also exclusive breastfeed babies that have HIV, but we give drugs to the mother and to the baby to protect them from having the HIV. So the the antiretroviral drugs protect the babies from getting HIV while they are still sucking their mother's breast. And the outcome is far better than when we're trying to protect them from HIV by giving them formula, because they were dying more from all the complications which we have talked about related to formula feeding. So even for HIV now, the recommendation is still exclusive breastfeeding, but of course we give the baby drugs. So we promote breastfeeding, and because a lot of mothers are confused by the formula milk manufacturers and all that, the WHO, the World Assembly, has to come up with what we call an international code. International code means that they cannot just advertise baby formula on see on TV or radio and all that. And it means that it has to be regulated. Only professionals can recommend. Most of you don't know that. Most mothers just go into the shops and buy their formula and bottles and all that. Ideally, those things has to be prescribed. We, of course, we know there are some situations where for some mothers will not be able to breastfeed. There are very few of them. Most of the people that are not breastfeeding is that you're not in that category. Most of you are just not doing it because you are not, you find it is maybe for convenience and all that. But the three I think three or two or three absolute contraindication to breastfeeding is: number one, a mother who is on drugs for cancer. If a mother has cancer and she has to be on drugs for cancer, she may not be able to breastfeed that baby. Okay, so that's one of those instances where sometimes we can't get the mother to breastfeed and we have to rely on formula. So some babies have some inborn error of metabolism. They are very rare conditions. They are not very common, very, very rare. And for some of those ones, sometimes we need to use alternative formula for that. I think those are the two major ones. HIV used to be part of it, but now we've taken it out and all that. So apart from those, a mother who is on anti-chemotherapy drugs and a child who has an inborn error of metabolism that could not take in like lactose or other things in breast milk, those are the only two people who cannot be fed with breast milk. And then the pediatrician will prescribe, formula. But most other people that are doing formula feeding, you are not in that category. So we encourage all those people to exclusive breastfeed their baby. And so to protect breastfeeding, we have what we call the code, international code, again, about breast milk substitutes, that it is important that even on your formula, the code says that it must be written on your formula that the breast milk is still the best. So if you are one of the people using formula to feed your baby, go and grab a tin now and look at it. You will see that it is written boldly on all of them that breastfeeding is the best way to feed your baby, so that you don't have an excuse. Just the same way when people are smoking and they say smokers are liable to die young, or so that they always warn you. The same way with formula. When you buy formula, it's also written on it that breastfeeding is actually the best for your baby. So even though you're using formula, you are aware of the best. And we always want to recommend the best for you. Of course, you have a choice, you have a free will to do what you want, but we always recommend the best for you. So that is why formula will never be advertised on your TV. You're not going to see it on TV advertisement. You're not going to see it being promoted and all that, because there's a code that regulates that. And NAFDAC is in charge of ensuring those codes are being. So we don't give free samples. That's why you never come to the hospital or antenatal clinic and they will give you formula as a sample for you to go and try. Never. It must not be done. So if they want to give them, they give it to the health professionals, and then we can recommend it for those that fall into the category that we need formula. Okay, I forgot the last one. I was trying to remember the third one. The third one where we may not also do breastfeeding is if the mother is dead. Sometimes mothers died, and before we used to do surrogate mother, maybe another mother, we can take their breast milk. So we used to have breast milk bank and all that. But the reason why we most of the breast milk fizzle out because of the HIV, and because even when people say they're HIV negative, there's always that window period where they may get infected and you're not sure yet, and they can transmit. So that is why we sometimes still need formula. If a mother is late, the baby has to eat now. So those are the only three instances where we cannot do exclusive breastfeeding, or we cannot do breastfeeding, because there's no mother, there's no breast milk. Or the mother is on chemotherapy drug for cancer, we cannot do breastfeeding. Or the baby has a condition, very rare conditions, that can mean that they won't be able to digest or metabolize the content of breast milk, then we can't give them breast milk. Or if you do that, that will cause some brain damage for them. Those are the only three absolute contraindications, or where you cannot do exclusive breastfeeding. Every other thing, there's no excuse for not breastfeeding. All right. So what we want to do is we want to support mothers. That's what we're doing today. So the theme for this year is about step up for breastfeeding, step up educate and support. So what I've been doing today is to educate you about breastfeeding, why you should breastfeed, why it's important to exclusive breastfeed your baby for the first 6 months and to keep breastfeeding for 2 years and beyond. And more important, we want to support you. I find out that a lot of mothers would have breastfed their babies, but they have the wrong people around them. Okay, the people that will tell you, you can't do it. This baby is hungry, or you better go and buy formula. And I think the grandparents, the grandmothers especially, they are the ones that are sitting on that table that I'm shaking right now. Okay. And I think sometimes the grandmothers are just being jealous about the baby because they want to have the baby. And unfortunately, there's only one thing nobody else can do for the baby. Only the mother can breastfeed the baby. Nobody, they can do everything else for the baby, bath the baby, carry the baby, dance for the baby, but only you as a mother can breastfeed the baby. And so sometimes people discourage a mother from breastfeeding so that they can also help do some other things. It is not right. So you as a mother, you need to understand the implications when you are doing other things. So we want to encourage you to breastfeed, and that's what we do. That's why we celebrate mothers who are exclusive breastfeeding, because we want you to be comfortable. We want to be in your corner. We want to encourage you to do it. And there are lots of challenges about breastfeeding. Of course, it's an art that you have to learn. It's something you have to learn how to do. Okay, so it doesn't come natural, but it's something that can be learned as well. It's something with the right support we can help you with that. So, which is what we're going to be talking about today. So, for example, I've already said that in the first 1 month, the first 1 hour, you should start breastfeeding. When you want to put the baby to the breast, the attachment of the baby to the breast is so crucial. Okay, attachment of the baby to the breast is 98% breastfeeding. Oh, if you get that right, you'll get breastfeeding right. But what normally happens is that most mothers, when they want to breastfeed, they put the nipple in the mouth of the baby. And the nipple, which is the part of the breast that drops out, I'm sure all of us know what the nipple is. That is not where the milk is, okay? The milk is under the areola. The areola is that part of your breast beyond the nipple that looks black or brownish or something. So you have the breast. If you can just configure, just think about what I'm talking about, the breast. The upper part of the breast that is very big and fatty and muscle doesn't do much when it comes to breastfeeding, but it just the tracts, the ducts or the pathway for the breast milk to get down flows through them. But then you have what we call the sinuses. Those ones, or the milk banks, they are under the areola. So that is where the milk is stored. Okay, that is where the milk is stored. So when the baby wants to suck, the baby needs to put their mouth on, or their gum on the areola, because when they put their gum on the areola, it's like turning on a tap, and the milk will just gush out into their mouth, and then they will suck and they will feel fulfilled and they will be happy. But if the baby is sucking on the nipple, there's nothing in the nipple. Okay, the baby does not get any milk when they suck on the nipple. The baby gets frustrated and they bite on your nipple or grind on it with their gum, cry and get frustrated, and then nothing comes out. So the baby doesn't want to suck anymore. And you as a mother, the milk stayed there in your breast, and you feel this, your breast is getting engorged, and you start having pain, you have nipple, all those nipple sores. If you're having sores on your nipples and all that, it's because you are not attaching your baby well to the breast. Once we see that, we know where the problem is. So when you want to feed your baby, you need to let them open their mouth wide, and then you shook everything into their mouth. And if you're properly putting it in their mouth, you will only barely see that areola. Almost everything will be in the mouth. If you are seeing the whole of that areola outside, that means your baby has only the nipple in their mouth. But if you put both the nipple and the areola parts in the mouth, you will only just see a little bit of that brown or black part of the areola. Everything should be in the baby's mouth, and then you will hear the baby sucking. You see them swallowing. They suck and they swallow, and baby will be happy. They will enjoy it. You also will enjoy it, because breastfeeding is not meant to be painful. It's not meant to be stressful. Okay, so that is how breastfeeding is. So a lot of mothers, when they are starting breastfeeding, they need that support in that first phase, and that is what the Babies Friendly Hospital Initiative is about. We want our nurses, our midwives, our lactation experts, our pediatricians, our doctors to support the mothers to establish breastfeeding. That first few days of breastfeeding is so crucial. You must get the breastfeeding established. We need to get it established. And that is when we should not start suggesting formula or suggesting glucose or suggesting water or suggesting anything. You'll go and rest. No. Even if you have cesarean section, you can breastfeed your baby. All right. Most cesarean section these days, we do it in a way that the mother is awake. So you are awake when your baby is being born. And so you can breastfeed your baby unless the mother has any health issues and she's not yet recovered, she's in recovery room or in ICU or not. That's otherwise, if you have gone to the ward, you're with your baby, you have no excuse to breastfeed, not to breastfeed your baby. You must start breastfeeding and do it in the first hour of life. Remember, it is the sucking of the baby on the breast that causes what we call the milk lets down. The milk must flow. The milk will only flow when there's a demand for it. It's so important that we get this. This is things that frustrate mothers about breastfeeding. You need to understand those principles. Number one, breastfeeding is a demand and supply mechanism. If there's no demand, there will be no supply. And the demand is the sucking of the baby on the breast. And the more the demand, the more the supply. So the more the baby suck on the breast, the more the milk will flow. So we need to get that. And the first few days, the milk that come out is called colostrum. It is not white milk. It is colorless or like slightly pale yellow or amber color. So sometimes when mothers see that, they think, oh, I'm not yet lactating. You're lactating, but you are not seeing what look like white milk. It is still milk, okay? And that colostrum is your baby first immunization. It is loaded with antibodies, with protein, with protective agent. Your baby must take it. Another myth that people do is to throw away that colostrum. Oh, they say it is sour milk. It is not, it is bad milk. And no, it is the baby's first immunization. You must not throw it away. You must feed the baby with the colostrum and you must let the baby keep sucking on the breast. So after 2-3 days, you will now see the white milk start coming out. And so it's so important that we get that right. And that's why it's so important that we support mothers. And one of the ways of supporting mothers is what we're doing right now. And the Global Health Media, they've produced what we call breastfeeding videos, very amazing videos that you can watch. They show you how to initiate breastfeeding, how to attach the baby to the breast, what are the position for breastfeeding. You can sit up to breastfeed, you can lie down to breastfeed, there are many positions for breastfeeding, whatever is comfortable for you. They also have how do you increase your breast milk supply, how do you know your baby is getting enough breast milk, if you're having nipple pain, what do you do, if you're having breast pain, what do you do. So they've done these videos, they are available on YouTube. Just search for Global Health Media videos. It's available on our Facebook groups. They also have an app, Birth and Beyond app. That app, once you download it, you will see all those videos there. You can download those videos to your devices, so you don't have to use internet to watch it again and again. You can always watch it. It's available in Yoruba language. It's available in Hausa language. It's available in many different languages. So you have no excuse not to breastfeed, because I know some of us may not have all the lactation experts around us, but those videos, they are very simple. And I think the longest of them is maybe 10 minutes. Most of them are about 5 minutes, less than 5 minutes kind of video. So they are very short. You watch them, you see how it is done, you practice them, and you can. And I think the most important thing for mothers when it comes to breastfeeding is your psyche. Breastfeeding is from your brain. It is not from your breast, okay? It is from the brain. Oh, if you make up your mind, I'm going to exclusively breastfeed my baby, you will do it, okay? You will do it, I'm assure you. But if you've made up your mind that I'm not going to do it, or I can't do it, or this or that, you are stressed, you are anxious, you won't do it, okay? Because breastfeeding depends on what we call hormones. There are hormones that tells the body to produce milk and send it to the breast and all that. Now, there are also hormones we call stress hormones, cortisol and the rest of them. When you are stressed and anxious and all that, your body produces the stress hormones, and the stress hormones tell the body, shut down breast milk production, we have other things to deal with now. So, and then you are not going to lactate, and then you get more frustrated, you get more anxious. It's a vicious circle, and it continues. But if you make up your mind, you're relaxed, you're seeing your baby, please let other people do all the other housework. Let them do every other thing. Please just eat, sleep, and breastfeed. That's all we want the mothers to do. And that is why at the Paediatricians Foundation, we've been advocating for the Nigerian government to give mothers 6 months maternity leave. You have no business going to work 3 weeks after having a baby. You have no business going to work 3 months after having a baby. You should be home with the baby for 6 months and breastfeed. That is all the job you have to do. Everybody else can wash clothes, can sweep. You need help. And that's why I love the Omu Girls concept. But let the grandmothers help you with those work, and you just focus on breastfeeding the baby. And so we thank God for states like Lagos State, and I think Kaduna and Ekiti. They now give the mothers 6 months maternity leave so that they can breastfeed exclusively. Because in the end, the government is going to benefit more. Because when the mother is at work and her mind is at home, because the baby is there, somebody is calling her, the baby is not eating, or this, it's going to make more mistake. At the end of the day, what are we saving? And this is an investment in our future generation. So the government also needs to contribute. So we're petitioning the federal government to make sure that exclusive breastfeeding, 6 months maternity with full pay for all mothers, so that they have time to focus on breastfeeding, because it's a very serious thing and that we need to do. So support for mothers is so crucial and it's so important. So even when you go back to work, you can still breastfeed. There are options. You can take your baby to work with you. Okay, for some of us, like when I was doing my residency, we have a crash in the hospital at the Lagos University Hospital. So take my baby to work. So when I'm working, when the baby is ready to feed, they call me and I rush back and I breastfeed and I go back to work. So you can do that. If you can't take your baby to work or the crash is not close by, and we encourage all the employers of labor, please support your workers to breastfeed their babies. Make crashes available. Just have a nurse there. Somebody will watch the baby. The mothers can go during break to breastfeed and go back to work. We all have it's something we all have to do, because it's an investment in our future of our children. So we need to all do it. Alternatively, you can express your breast milk. If you start expressing your breast milk, you can store it in the fridge. If you express your breast milk and leave it outside without putting in the fridge, it can stay for 6 hours without any preservation. Just leave it on its own. So if you express in the morning for 6 hours, they can still use that breast milk and nothing will happen to it. If you put it in the fridge, it can last 5 days. And so when you express, always express just the quantity a baby will finish at a time. So you label them in different bottles or cups that have a cover. You put the date and the time that you expressed, and you store it, so that when they use it in the reverse of that. In other words, the one that was expressed first will be used first before the one that was just expressed last. So you have to label it properly. So you keep it in the fridge. It can last 5 days. If you keep it in the freezer of your fridge, okay, it can last 2 weeks. If you keep it in deep freezer, the one that you don't open all the time, it can last 3 months. So there are many ways you can exclusive breastfeed. Even as a working mother, you can express your breast milk, you can store it, and other people will use it for you. So when they want to use the express breast milk, they just bring it out, put it they allow it to thaw. And like maybe if, for example, if you are putting from the freezer or fridge, you allow it to thaw, and then you just put that cup or container where you've kept the express breast milk, you put it in another bowl of maybe hot water. We don't encourage microwaving and all that, because microwave will leave some place very hot and some place very cold. It doesn't evenly eat, and that could be dangerous for baby, because baby can get burns. So we don't want that. So just put it in another big bowl of very hot water, and it will warm it up to that temperature, and then you can feed the baby with it. So there are many ways you can breastfeed. There's no excuse for doing that. So it's breast milk only. Then after 6 months, you can now start adding other food. Please, after 6 months, some mothers will do exclusive breastfeeding, and after 6 months, they're like, thank God, oh, I'm free of breastfeeding. Then it's only food. No, you are not yet free. Oh. You keep on breastfeeding, but you are adding other food. You don't reduce. Mistake mothers make, they will tend to reduce breast milk and do more of the food, and then they start getting into other troubles. You don't reduce the breastfeeding. You keep breastfeeding, and then you add other food. Okay. All right. So I think I'm going to stop that. For those of you who want to sign our petition for the Nigerian government, I think I have this one for the Taraba. I have the other one. So for the government to sign to give 6 months maternity leave to all mothers, I think we did one for all the states. Please, you go to change.org, just search for I will find the link later and send it, or you can just search for Ask the Pediatricians Foundation. That's our petition, and we're advocating for all working mothers to get a 6 month maternity leave so that they can exclusive breastfeed their babies. All right, thank you so much. I will take a pause there, and we have. Oh, okay. I can see Fresh Waste Radio has been sharing a lot of the stuff, and then we can ask question. Okay, so let's start taking a question now.
Okay, so let's start taking a question now. Okay, thank you very much, man. That was really, really insightful. Thank you so much. Okay, we have a question from Faith Udaya saying that what causes breast sores during breastfeeding and what's the cure?
Okay, thank you,
Okay, thank
AKG,
you, AKG.
for asking that question. I'm sure you asked the question right from the beginning of the program before I did all my overview. I'm sure you know the answer to that question now, but just to recap it, if you are having breast sores or nipple sores, it's because you are not attaching the baby properly to the breast. Like I said earlier, attachment of the baby to the breast is 99% breastfeeding. Okay, that means your baby is sucking on the nipple rather than on the areola. So I will encourage you to watch our breastfeeding videos, Global Health Media videos. They're on YouTube, they're on our Facebook group, they're on Birth and Beyond app. Or just ask on our Facebook group. Somebody will send you the link so you can download, you can watch, and then you can get that attachment of the baby to the breast properly. If you already have sores, what you need to do is very simple. You can hair the breast, and like in other words, let some hair blow on it. You can apply even your breast milk on that sore. Or we also have some nipple cream, lanolin, and some of things like that that is sell that you can apply on it. It's safe. It is safe. It doesn't cause any harm to your baby when they suck on that breast. You just allow it to heal. Okay, that is one thing you can do. You can do more of breastfeeding on the side that is not affected, and or you can express during that period while it is healing so that it will heal. Then you can be feeding your baby with express breast milk. If it's only on one side, you can let that side as you can express from that side while you breastfeed on the other side. If it is both, then you can express, and usually 2-3 days they should heal fully, and then you can resume your breastfeeding. While they are healing, you can use express breast milk. So that is for the nipple sores. Okay, sometimes some mothers actually have the proper breast abscess. Now, breast abscess is when a baby who is not sucking, who is not draining the breast, and the breast gets engorged. How you know your breast is engorged? That it is so full and hard. It will be hard and it will be painful. So that is because the milk are not coming out. Again, is because of the baby not sucking on the breast or the baby not properly attached to the breast. Because when your baby suck well on the breast, you should feel your breast empty. You'll feel it going flat, kind of, but you know what I mean. So, but if your baby is not sucking well, especially in the first few days, the breast will be so full and painful and hard. That is breast engorgement. And if you don't drain that breast as soon as possible, it can now get infected. If any infection happens, and then you now have like pus coming out. We call it breast abscess. If you have that, then the baby, you have to see your doctor because they need to give antibiotics. So you need to take antibiotics, pain relief. We need to bring out the pulse as well. And during that period, you cannot use that breast to breastfeed. You can express out of it so that the milk will come out, but you cannot use the breast to breastfeed that particular one until you've completed your antibiotics and the wound and the sores and the pores have all been out. But you can breastfeed on the unaffected side. To be very unusual for you to have it on both sides. Usually is one. So, but that is breast abscess, different from nipple sores. So you need to differentiate the two. But breast abscess is not very common. It's more in those who have breast engorgement, who was not treated on time, now have a super infection. Those are people that have the breast abscess, but it can be treated with antibiotics. But the nipple sores, you don't need much antibiotics. That you just need to expose it to hair to dry, apply nipple cream, or you can apply even your breast milk on it, and it will heal and it will be fine. All right. All right. I hope that's helpful. Um, let's go to the next question.
Okay, thank
Let's go
you,
to the
ma.
next question.
So the next question from Onyezi Chinenye. She said, "How do I get my baby to be eating well? We are 6 months and she uses her tongue to bring out the food."
Okay, thank you, Onye. So a lot of mothers always made this complaint, and some of them actually threaten us that because when they did exclusive breastfeeding and when they are now changing to complementary feeding, the baby just like the breast and they don't want to eat other food. They just want to be sucking and sucking. And so mother would threaten the pediatricians like, "I don't think I'm going to do exclusive breastfeeding next time." And I always tell them, your baby not eating has nothing to do with exclusive breastfeeding. And indeed, exclusive breastfeeding actually helps your baby to eat better because the flavor of all the food you eat, your yam, your apple, your fufu, and everything, the flavor of it goes into your breast milk. And so your baby already tastes and know the taste of those flavor of food that you're eating. So when it is time for you to start feeding your baby, they should be able to eat food better. Now, the issue of most of the time because mothers don't do complementary feeding right. And I don't want to go into complementary feeding because it's a whole topic on this. So we've done it already, but we always do it every year because it's one of the most frequently asked question directed to a pediatrician. Doctor, my baby is not eating. Okay, and people are expecting a magical drug from Dr. Gbemi to make the baby to eat. And I always tell them, I'm sorry to disappoint you, there is none. So it is about getting the complementary feeding right from the beginning. Okay, when you are introducing something new, you just imagine yourself, you go to a new country and you are going to eat the food. Some of you are very adventurous and you jump in straight, but some of us we kind of take our time to cover taste a little bit and see, is it, do I like it or not, before we now, if it's something we like, then we jump into it. The same thing. Babies have been on breast milk for 6 months. So when you are introducing new food, you have to do it gradually. And unfortunately, a lot of mothers expect the babies to finish the same quantity of milk they finish as breast milk as complementary food. No, it's not. The idea of complementary food is that it is this the smaller quantity has higher calories because it's solid, it's not liquid. Liquid, you need to take a lot of volumes. And that is why we're actually switching from exclusive breastfeeding now to complementary feeding, because after a while, the amount of volume you need to give the amount of calories baby will need will be too much. So, and baby, once you're getting above 1,200 ml of breast milk, that's the stomach of the baby cannot take too much of liquid. So the idea is we are now giving solid that has more calories, but in a smaller measure of volume to add to those calories the babies are getting from breast milk. So when you're introducing complementary food, you have to remember those principles. Number one, it is not the same quantity you will give as liquid that you're going to give as solid. Most of them don't need more than 25 mils, 50 mils, 100 mil, like half a cup, then three-quarter of a cup or a full cup. That is what they need. Two, it has to be gradually. So for the first 1 or 2 days, you do 1 or 3 spoons. That's all. But you don't expect them to finish 200 meals or a big bowl of food that first time you're introducing it. And for the first 2 months, 7 months, breast milk is still like 80% of what they are going to be eating. You're only going to add the other food like twice a day. And the quantity, like I said, half a cup. So it's not much of solid. But a lot of mothers want to go to full solid every 3 hours of solid, or maybe 3, 4, 5 times a day solids, and the rest is breast. No, it is still breast milk most of the time, and 2 meals of complementary food that is just half a cup. And of course, the right quantity. And of course, it doesn't have to be a particular cereal, maybe pap that has no sugar, no milk, no. So if you want to really understand how to do complementary feeding, I always also say watch we also just like we have the breastfeeding videos, we also have the feeding videos as well. Also made by Global Health Media. You can also watch that, download it and watch it. We also have a lot of resources. I've also done an hour of infant feeding in the first 1,000 days on ATP Hour on Fresh Waves Radio. You can watch it, you can listen to it again because it's a whole topic on its own. So the issue is getting it right and doing it right. So I'll leave it as that. Yes. Okay, let's just take the last question from Facebook, then we'll go to Instagram.
Yeah. Still from Chineye saying I got pregnant while I was still breastfeeding and I breastfed till I put to bed. Is it true that my new baby didn't get the colostrum?
Uh, okay, that's a little bit tricky question. Um, Yeah, so what you did is right. We call it tandem breastfeeding when you breastfeed and you breastfeed into another baby. I think your new baby will still get colostrum because the milk production will change in the middle, from your first baby to the second baby because your body and the hormones and all those things will change around. But I really don't think you need to worry about that. The most important thing is that your baby got breast milk. Okay. But please, when you are this second baby, please go for family planning because breastfeeding is not 100% foolproof. And we really don't want you to be in this scenario. Okay, we want you to have weaned one baby after 2 years before you get pregnant. We want you to space those pregnancy by at least 2 years because we want your body to recover. Remember, you've had pregnancy, then you breastfeeding. It's a lot of toil on your body as a woman. So we really prefer you space your pregnancy so that you are fully recovered before you go for the next one. It is better that way. Okay, so when you've had a baby at your 6 weeks postnatal check, go for family planning. And there are lots of options: IUCD, injections, implants, the one that they put there and you forget that it's there, and you don't have to worry. It's better that way because I know it's not like, thank God you are fine, your baby are fine, but you are putting a lot of demand on your body, which is not so good for you. And I think I'll really leave it at that. All right.
Okay, still from Adewale Mariam saying what makes exclusive breastfeeding babies without starvation, not gaining weight?
All right. Thank you for that question. When people say a baby who is on a switch breastfeed does not gain weight, I always like to say that gaining weight is not only about breastfeeding, okay? Gaining weight is more than food, okay? If a child has a medical condition, health condition, underlying issues, they may not gain weight. And that is the job of a pediatrician to know why the child is not gaining weight and all that. So the first thing, if a child is not gaining weight, when you come to us as pediatrician, the first thing we do is to establish the fact that you are actually giving the baby breast milk at the right amount. So sometimes people say I'm breastfeeding, but if you are giving it on the nipple, like I said earlier, you're actually not breastfeeding, so baby's not going to gain weight. So we need to establish that. Sometimes we get you to actually express the breast milk. We actually monitor the quantity of the breast milk the baby gets. When your baby is sucking directly, you don't know how much is going in, how much is there. So, but we have to get you to express it, and we measure it. We know, okay, your baby is supposed to get maybe 5 kg. Baby should be getting about 500 mils of breast milk. So we measure that baby actually get 500 mils. So after we've ensured that your baby is getting enough milk and your baby is not gaining weight, then we now look for why the baby is not gaining weight. Is there a health problem? Is there a hole in the heart? Is there a problem somewhere? So that is the job of the pediatrician. So if there's no underlying health issues, and the baby is getting enough of the volume of the breast milk, the baby should be getting, the baby will gain weight. The baby will gain weight. So if baby is not gaining weight, it's either the baby is not getting enough of the milk or the baby has an other health problem that is not making baby to gain weight. So that child should see a pediatrician. That child has failure to thrive, and it's the role of the pediatrician to figure out what exactly is going on. All right, I quickly take the Instagram people's question. We have 1 minute left on the program, but I'll see. Somebody say, how do I deal with breast engorgements? I think I've answered that. you need to get your baby to suck on the breast, attach that baby properly to the breast. The baby need to suck on it, and it will flow out. You can also apply warm compress. You put your hand face towel in warm water, squeeze out the water, just apply on it, and if the milk may flow better, you can actually express that milk and store it and give later. But the milk has to come out because it's the milk that is causing the engorgement, and it's because the baby has not been sucking. If you give your baby formula and all that, you may have breast engorgement because the time baby should be sucking on the breast, baby is taking other food or other water or other things. So that is how to get rid of breast engorgement. Okay, let me see where the remaining question on Instagram. Yes, 6 months. Somebody saying no sound. I hope you can hear me. I think other people can hear me. Somebody said the mothers produce colostrum in every single pregnancy. You produce colostrum after you have your baby. Yes. So colostrum is the first milk that you produce after having the baby. Yes. So with each pregnancy and each delivery, it will be fresh. Because ideally, we expect you to have stopped breastfeeding and stop the whole phase of one before you embark on another pregnancy and before you have another baby. So, and those mothers that get pregnant when they're still breastfeeding, they are the one that's having the issue of is there colostrum or not. But I think there should be colostrum because it's a new or rearrangements in the body going on with the birth of a new baby. So the next person saying, good morning, doc. I told you my baby had breast enlargement since 3 months. She's not feeling any pain. Should I be worried? Oh, thank you for asking that question. You don't have to worry. Leave it alone. So some babies are born with breast enlargement. Okay. And what happened is because the same hormone that works on you as the mother to get your breast to be big, to get ready for breastfeeding, that same hormone also acts on your baby's breast because it's in your blood. So some of it pass on to your baby and they make your baby's breast to be big as well. And sometimes your baby can actually produce breast milk as well. So if you price the breast, which we say you should never do, but some mothers do it, you will actually see the milk coming out. So it's just that same hormone that works on your own breast, the same progesterone, prolactin, those hormones, they're the same one working on your baby's breast, causing the breast enlargement and even causing the milk to be produced as well. So, but please do not press that breast because what mothers do is that they start to press it, then you introduce infection, and we have what we call mastitis, and sometimes we have what we call abscess, like pus will come out of that breast. If that happens, you are going to end up in our hospital. You are going to end up needing antibiotics for the baby. We may even end up needing to do a small operation to bring out the pus. So what you need to do is to just leave it alone. Leave it alone because once the baby is born, that hormone supply to the baby stop. Okay, and so the baby is cut off once the umbilical cord has been cut. So there's no more hormone from your blood getting to your baby's blood. So what means that whatever has been there before will go down, and over some months the breast it varies from one baby to another. Some babies within a month or so, some it may take several months for it to go back to its normal size, but it doesn't do any harm to the baby. Just leave it alone. I found out that it is not leaving it alone that always causes the problem because mothers are pressing it and then it causes infection and we have to deal with another problem altogether. So just leave it alone. All right, I think that's all the questions. Thank you so much for listening. Like I said, this program has been brought to you by Ask the Pediatricians Foundation with support of Fresh Waves Radio. If you have any question, feel free. If you still have any question about breastfeeding, we're still doing a lot of breastfeeding. The whole of this week is breastfeeding. So join us on Ask the Pediatricians Facebook group. Today, I think in the evening and tomorrow, we have our lactation expert consultants. The nurses, they're going to be there also talking about all these practical aspects of breastfeeding. You want to join them. And on Saturday, which is the last day, I'm going to do an open house on breastfeeding. So it's going to be a post and you can drop your question and I'll just answer it from morning to evening. So you can also use the opportunity to ask your question. Of course, you can always ask your question on Ask the Pediatricians every every day, Monday to Saturday, and we will try and answer them. So thank you so much for joining me, and it is bye from me. Sorry,
We
I
are
think I've
grateful.
muted you.
Thank you.
Sorry, I think I've muted you.
Now I'm on mute now. So thank you very much. We are grateful and thank you for joining us. We hope you join us again next Thursday, this same time, and still on Facebook, every other platform, and on www.freshusradio.com. Thank you very much, Ma. Do have a blessed day.
Thank you so much, everyone. Bye.
Thank you so much, everyone. Bye.
In the heart of its tomb, breastfeeding.